Okay, so now it's been a couple hours. We know that the fluid is warm enough for the patient, and the patient's ready to go on. So here we do the dressing change right before we connect. This is the connector piece. It's often taped to here, and so by taking the tape off, it messes up the dressing change. So we do it right before we go on. So we took this off. It's laying here. Once again, when going into dressing change, everybody needs to have a mask on. So you, the patient, and any family member that's in the room. You're going to do hand hygiene. You're going to put gloves on. Your patient will be ready for this and is very familiar with how to do with this. We do it sterilely, which is a little different than they do at home, so we always remind them that this is just a little bit of a dirtier environment, so we like to be a little extra clean. So always clear off their bedside table. You will need that, and you will clean it with Oxivir or bleach. So I've already done that. And then I'm ready to set up my sterile field. This is a sterile procedure. So you will need a package of sterile towels. You will need sterile gauze, sterile drain sponges, and a package of sterile gloves for yourself. You will re-clean right now with ChloraPrep, so you will need to make sure you get the ChloraPrep wand. Hopefully, if this is the first time that you're doing this, you'll need to make sure that you get this Durapore tape. This is the specific tape that we use for this. It binds to the skin a little easier and makes it much more occlusive than a normal tape. And then every patient that has an order for PD here at the hospital, all of our renal docs order gentamicin, which is part of the order set. So you should have an order for gentamicin, and it will come in like a tube for you for each patient. So you want to set up your sterile field. You're going to get your sterile towel. Remember, you're not sterile yet, so you want to make sure that you touch corners only. To set that up. Then you're going to open up your sponges. And you're going to drop them sterilely onto your field. And then your chlorhexidine, you want to get it sterilely stuck down there too. And then very carefully with your gentamicin, because your gent's not sterile, you're going to drop some onto the drain sponge. And you want to make sure it's specific because it needs to be against the skin. So it's only going to go on there. Then you're ready to take off the old dressing. We don't want this open, that's why we set that up and then take off the dressing. Just be very careful with the line. There is a couple things in there that's keeping it from pulling out, but it does tug on the patient a little bit. You're ready to put your sterile gloves on. So you're going to take your clean gloves off, do hand hygiene, and put your sterile gloves on. Okay, so now you is dab on the gentamicin to kind of get it stuck on there for when I'm ready for it. Because I will tell you, I have a little hint. The first time I did it, it fell off because I didn't dab it, and so it wasn't like stuck on there. So I kind of do that, and then I go to clean. Now I do have a dirty hand and a clean hand because I am going to have to touch the tube a little bit while I clean. So you pop your chlorhexidine, and you do in concentric circles. You go kind of all the way around. Make a nice big area to where it's clean. If you see anything on the line, you can clean it a little bit, but they don't want you doing that a whole lot because you want to be very careful not to get any solution down into the track of the tube. So most of our patients are pretty clean. We don't have to do that. But if you see something like some cream or something, just lightly do it so that we're not getting anything into that track. Then you kind of let it dry for a couple seconds. You get at the drain sponge with the gent. The gent's on top, so you got to turn it upside down so that the gent is right on top of the skin. You do one way, and then you put the second one the other way. And then with the cover gauze, you just put that right over the top. And now that it's covered, you don't really have to worry about too much sterility. You're still wearing your mask, but you don't have to worry about now touching the unsterile tape. You just need to tape it up, and it does have to be occlusive. When doing this, you can do either size, the 3-inch or the 2-inch. Both will work. You just need to make sure that it's occlusive. And we all know that the warmer this is, the better occlusive it gets. That's what's so great about this tape. And you notice I kind of put a little thing just kind of tightened around that tube right there so it's occlusive around that. Then I can take this off, my gloves off. And just like any other normal dressing, you're going to date and time it. Okay. So now you're ready, or he's ready to be hooked up. So I'm going to do hand hygiene.
After you complete the dressing change, you'll need to document that you changed the dressing in the patient's chart. Very similar to how you would go in and document that you change a dressing on a central line. So you'll go into your flow sheets for adult PCS body system, and you'll go down to where the LDAs are listed, and you will locate the peritoneal dialysis catheter. And you will complete the appropriate rows based on the care that you provided for the patient during the dressing change. You'll complete your assessment on the site, and you'll document. The dwell time will be information that is included from the order.